Chest pain is a painful manifestation that can affect only one part or the entire region of the chest. It can be of an absolutely benign nature or a sign of a serious and urgent problem to be addressed and treated immediately. It's quite frequent and represents 5% of all cases of access to the emergency room. In this video, we will see what are the possible causes, what are the possible warning signs, and what is generally done in these cases. Hi, and welcome to Med4Care. Today's topic is chest pain. Chest pain does not always manifest itself in the same way, and it is very important to recognize and describe it accurately. In this way, if the emergency system is alerted due to this condition, the operators can assess the situation and best evaluate what to do. Chest pain may feel like oppressive and squeezing, and in other cases like throbbing and stinging. The duration of pain is one of the main variables. If the pain is momentary, stabbing and passes quickly, it is most likely a contracture of an intercostal muscle, therefore there is no need to be alarmed. If, on the other hand, the duration of the pain is prolonged, more than a minute, and it is of a constrictive, oppressive type, it is certainly advisable to alert the emergency personnel for a quick check by a doctor. In this case, in fact, it is possible that it is a pain referring to the heart, and consequently it is advisable to treat it as such until proven otherwise, which only a doctor can verify. The most worrying event that can be hidden behind chest pain is a possible heart attack, which generally manifests with prolonged oppressive or constricting pain and does not change with body position or breathing. On the other hand, pains that change in intensity with position or with breathing are often attributable to muscle pain, postural pain, stress, or other non-cardiac causes. Now, let's see what are the possible causes of chest pain one by one. Typically, the cause of chest pain is an inflammatory problem that occurs within the chest. In most cases, it's a benign condition that does not affect the heart or lungs, but rather muscular, skeletal, or digestive system disorders. In fact, only in 1.5% of cases is a serious pathology hidden behind it, such as an acute myocardial infarction. However, if the pain has the characteristics mentioned before, such as a prolonged duration and an oppressive coercive type, it is more likely that the cause is serious and should be investigated by a doctor. Let us now see the various causes, dividing them into 3 categories based on the affected area: cardiac, pleuro-pulmonary, osteomusculoskeletal causes. Cardiac pathologies or heart disease are represented by angina pectoris, pericarditis, acute myocardial infarction, cardiomyopathies, valve defects. Conditions that lead to a pathological change in the lung or pleura can also lead to chest pain, among the most significant: pneumonia, pulmonary embolism, pleurisy, pneumothorax. Finally, among the non-cardiac and non-pulmonary causes of chest pain, we have traumatic, inflammatory, or degenerative events affecting the bones, muscles, or tendons that make up the thoracic region, such as rib fracture, bruises and direct injuries to the chest, sprains and tears of ligaments or muscle tendons of the pectoral muscles or intercostal muscles, inflammation of the rib cartilages. This category also includes problems in the upper part of the abdomen, which, being close to the lower part of the chest, can be identified as pain coming from the chest. Among these, we mention gastroesophageal reflux disease, hiatal hernia, cholecystitis, or gallbladder stones. In children, chest pain is frequently of benign origin and is not related to cardiac disorders. Most forms are of a known cause. They will be defined as idiopathic or of a musculoskeletal nature, resulting from prolonged exercise, coughing, or direct trauma to the chest. About 1 out of 10 cases have pulmonary causes that need treatment, for example, for acute bronchitis, pneumonia, or allergic asthma. The complete assessment of the symptom can initially be taken over by the general practitioner, who may request, if necessary, a more in-depth specialist examination of a pneumological or cardiological type. The visit begins with a detailed history, some questions to understand the characteristics of the pain. For example, what were you doing when the pain started? How long did it last? How many times does it appear during the day? The doctor will then go to investigate the possible presence in the family of coagulation disorders or chronic metabolic diseases such as diabetes mellitus. Estimate the risk factors associated with the onset of myocardial infarction and pulmonary embolism using the Wells criteria. The visit therefore continues with the objective examination of the patient. Among the first actions, the doctor detects the vital parameters, then tracing a general profile of the patient, then examine the entire chest region, inspecting the state of the skin and looking for points of tenderness or crepitus. Evaluate the presence of edema or swelling, often a sign of heart disease. Finally, he will use the stethoscope to listen to the chest and back, assessing heart and respiratory function. The effective diagnosis of chest pain can make use of the execution of some laboratory and instrumental tests, including radiography, electrocardiogram, CT pulmonary angiography, ultrasound of the thoracic region, blood tests including complete blood counts and some cardiac markers. Once the diagnosis is made, the patient with chest pain is treated according to the underlying cause of the pain. In some cases, such as gastroesophageal reflux disease, your doctor will prescribe specific medications, such as proton pump inhibitors or PPIs. If the pain emerges following particularly intense emotional efforts or anxiety states, the administration of tranquilizers or benzodiazepines will be useful. In more serious cases, it will be necessary to hospitalize the patient and proceed with specific therapies and/or surgery, such as, for example, the insertion of a special chest drainage tube in the case of pneumothorax or the surgery of mechanical unblocking by angioplasty in the case of severe coronary syndrome. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like, subscribe to the channel, and click on the bell to be notified every time our new video comes out. See you soon in Med for Care!